What is measles? Measles is an acute infectious viral disease, which is manifested by an increase in body temperature, a large number of rashes and cold symptoms. There are two forms of measles: atypical and typical. The first is easier and, in turn, is divided into mitigated atypical measles. During the incubation period, it occurs in people who have been given prophylactic measles immunoglobulin or who have received blood transfusions containing measles immunoglobulins. In this type of disease, there is no catarrhal period. Body temperature rises to a maximum of 38 degrees Celsius. Filatov-Koplikov spots, small white spots on the oral mucosa, are not formed. Abortive atypical measles. The body temperature rises and does not decrease for 3 to 4 days. Rashes are pale pink, not many, only on the upper part of the body and on the face. The patient recovers in 4 to 5 days. Suppressed atypical measles. The patient feels a little weak. A rash does not appear. Only a slight runny nose can be observed. Asymptomatic atypical measles. It does not show itself in any way. It is diagnosed by conducting laboratory tests. Typical measles is mild, moderate and severe, with or without complications. Causes of measles. Measles is caused by an RNA virus of the morbillivirus type. In the external environment, it is unstable. It disappears when exposed to direct sunlight, heated to 50 degrees Celsius, and dried. At room temperature, the virus lives for 1 to 2 days. The source of the measles virus is an infected person. It begins to infect people around it in 1 to 2 days of the incubation period, up to 4 days of rashes. In some cases, the infectious disease lasts for 10 days from the moment of the rash. Measles is transmitted by air droplets, aerosol mechanism. An infected person spreads the causative agent of an acute infection to the environment during sneezing, coughing, and talking. A finely dispersed suspension is spread throughout the room by the airflow. If a pregnant woman has the disease, she can transmit it to the fetus, transplacental transmission. All people are susceptible to measles. After experiencing it, lifelong immunity develops. Pathology often appears in childhood. Adults rarely get measles and have a milder illness than children. The disease worsens in winter and spring. Infection is very rare in August and September. Pathogenesis of disease development. The RNA virus of the morbillivirus family enters the body and bypasses the mucous membranes of the upper respiratory tract. It multiplies in epithelial cells and spreads with blood flow. Measles has the strongest effect on the conjunctiva, skin, mucous membranes of the mouth and respiratory tract. Sometimes it affects the brain, in which case measles encephalitis develops. The epithelium of the mucous respiratory system affected by the measles virus can undergo necrosis. As a result, the risk of bacterial infection increases. The causative agent of the disease can remain in the human body for a very long time, which leads to the appearance of serious systemic diseases: systemic lupus erythematosus, scleroderma, sclerosis. Symptoms of measles. The incubation period of measles is 1 to 2 weeks. If the patient is given immunoglobulin, it can be extended to 3 to 4 weeks. The typical form of measles excludes 3 consecutive stages. Catarrhal. It begins with a sudden rise in body temperature, with clear signs of general intoxication. The patient experiences a severe headache, suffers from insomnia and weakness. A dry cough is added to the symptoms of intoxication. Conjunctivitis can be observed, eyelids become very swollen. During auscultation, listening to the lungs, the doctor notes dry wheezing and heavy breathing. In some cases, the catarrhal period of typical measles is accompanied by vomiting, nausea, belching, chills, and diarrhea. The first wave of fever does not exceed 3 to 4 days. Then the temperature drops to normal values, but the next day it rises again. Symptoms of intoxication increase sharply, catarrhal phenomena become more pronounced. If you look at the photo of measles, it will be clear that these are small white spots surrounded by hyperemic mucous membrane. When a rash appears on the skin, the spots disappear. Parallel to them, as a rule, enanthema is formed on the hard and soft palate, that is, red spots with an irregular shape. The catarrhal period lasts about 5 to 7 days.